Welcome to Life Extension's webinar series. This is the tape version of the live webinar for those of you that couldn't participate. My name is Dr. Michael Smith, and today we're going to talk about 5 heart disease risk factors your doctor won't tell you about. Now, we always have to begin every webinar just letting you know that the information that we present is not meant to diagnose, treat, prevent, or cure disease. And you should always speak with your own doctor before starting any diet, supplement, or exercise program. Here's one of my favorite jokes. I always like to start off with a joke or two, and here it says, what fits your busy schedule better? Exercising 1 hour a day or being dead 24 hours a day? Well, this is important because we're going to talk about a lot of nutrients tonight that you can add to your supplement regimen to help protect your heart. But always remember, it really does begin with a good diet and exercise program. Supplements only supplement a diet. So keep that in mind. So let's get started. Here's a case study. Here you see a gentleman here playing golf. And he presents to his doctor's office, let's say, for a routine yearly visit. And he's slightly overweight, normal cholesterol, normal blood sugar, normal blood pressure. He does have a positive family history for heart disease. His dad had a heart attack when he was 60 years old. But for the most part, this gentleman right here playing golf would get a clean bill of health. But what happened, let's say a month later, heart attack. All of the mainstream risk factors were normal, yet people are still having heart attacks, strokes. We are still seeing a rise in the incidence of heart disease in this country, even when people have normal traditional risk factors. So what are we missing? And that's what we focus here at Life Extension, those missing risk factors that your doctor may not talk about and may not even know about. Mainstream medicine basically focuses on the traditional risk factors of obesity, high LDL, that's the lousy cholesterol, low HDL, the good stuff, high blood sugar, high blood pressure, and one I don't have up here that I should is smoking. Now, if your doctor goes through these traditional risk factors and checks them off and everything looks fine, you get a clean bill of health, at least as far as your heart is concerned. But we still know that people have heart attacks in this case. So what are we missing? At Life Extension, we've identified 11 additional risk factors. We call them the daggers of heart disease. And tonight we're going to talk about 5 of them. So let's look at the first one. Number 1 is insufficient amount of vitamin K2. Now, vitamin K comes in 2 different forms in nature. There's K1, and that's the one everybody knows about. K1 is the version of vitamin K that actually helps your blood to clot when you need to. K2, on the other hand, is the unknown heart vitamin. K2 is that forgotten form of vitamin K that's critical to your heart. K2 is also further broken down into 2 subforms, and the most important ones for your heart are the MK4 and the MK7. So we're going to focus on what vitamin K2 does to protect your heart. Vitamin K2 is so important because it's involved in calcium management. It actually stabilizes blood levels of calcium, and it does so by taking calcium and directing it into your bones. So it manages calcium in your body. If you don't have enough vitamin K2, you don't manage calcium correctly. Now, the way vitamin K2 transports calcium from the blood into the bone is by activating certain proteins, these bone-building proteins. It's involved, for instance, in one called osteocalcin. When you have higher levels of osteocalcin, that's an indication that you're involved in bone-forming processes. Now, the traditional food sources of vitamin K, if you just think of vitamin K in general, most people right off the bat think of your leafy green vegetables, or maybe even your cruciferous vegetables, like the broccoli, for instance. And that's true for K1. However, vitamin K2 really comes from our meats and our milk products. And we don't get a lot of it from the meats and the milk, the dairy. Now, your body will convert K1 into K2, but if you're going to rely on that process to happen, you're going to be very insufficient in vitamin K2 levels. As we get older, we just don't convert things in the body as well. And that's going to leave you deficient or insufficient in this very important heart-healthy vitamin, vitamin K2. This is a great slide because it kind of shows you exactly what we're talking about here. If calcium starts to go up a little bit too much in the blood, see, your body likes to keep blood calcium at a very narrow range, and it's important that it does that. Not enough calcium is not good in the blood, and too much calcium in the blood is not good. And any time calcium starts to rise a little bit in the blood, vitamin K2, if you have enough vitamin K2, it will take that calcium and shunt it into the bones. It'll activate those bone-forming proteins. So vitamin K2 is taking that excess calcium out of your blood and putting it into your bones. Now, if you don't have enough vitamin K2, what tends to happen is we start leaching calcium out of the bones. That's the right side of this screen here. Without enough vitamin K2, we mismanage calcium. It tends to stay in our blood instead of being in our bones. And when calcium is leached out of the bones, it can deposit within the wall of the arteries. That's where that term hardened arteries comes from. So you can almost see here that vitamin K2 is critical really between the arterial system and your bones. When you have a decent amount or an optimal amount of vitamin K2 in your body, you're going to manage calcium better. That calcium is going to be shunted from the blood into the bones. Your arteries are healthier and your bones are healthier. Without vitamin K2 or deficiencies or insufficiencies in vitamin K2, the opposite occurs. Calcium is leached out of the bones, bones become brittle, arteries become hard. This is a scan, what is known as an electron beam tomography, an EBT test. This is where we can actually measure how much calcium is actually within the arterial wall of the coronary arteries. If you look at, these are different pictures of the heart and different phases of when it's pumping. But what you see here are these white streaks. You guys see this? Those white streaks are the arteries. They're not supposed to look white like that. That white comes from the calcium hardening in the wall of the artery. The more calcium you have in your artery, the higher your calcium score will be off an EBT scan, an electron beam tomography scan. Now, the standard medical doctor or the standard healthcare practitioner out there wants a calcium score to be less than 400. Well, at Life Extension, we still think that's too much calcium in your arteries. It probably represents that you don't have enough vitamin K2. So we actually believe a optimal calcium score, an EBT scan, is less than 100. If you were to do this scan, ultimately, you don't even want to see these arteries. They almost want to look translucent next to the heart. That means there's not calcium building up in the wall of the artery. And the way you're going to do that is having optimal levels of vitamin K2. And that's really the goal here when it comes to risk factor number 1 that your doctor probably won't talk about: optimizing vitamin K2 blood levels. Now, obviously, remember, supplements only supplement a diet. We want you to eat the right foods, vitamin K rich foods, leafy green vegetables, cruciferous vegetables. That's where you're going to get K1. K1 from the diet will convert into K2, but we don't do that very well. Lean cuts of meat, dairy, you're going to get some K2 out of them, but probably not enough. So we do believe that supplementation with vitamin K2 is critical if you want to protect the health of your heart. So about 1,100 micrograms per day of vitamin K2